Welcome to the Wounds That Do Not Heal. My name is Tressa Brady. After my own experience and hearing time and time again about domestic violence in military families, I decided to start this podcast. Tune in for stories, resources, and guidance on how to get the support you need for your family and your safety. Hello, everyone. Thank you for joining. I'm Tressa Brady. You're listening to The Wounds That Do Not Heal. And I am here today with a special guest, Dr. Shauna Springer, or as the military and veteran community call her, Doc Springer. She's a beloved member of their community. And we are really excited to have her. She is a licensed clinical psychologist, a Harvard graduate. She is one of the nation's leading experts, I would argue one of the world's leading experts on trauma initiatives that affect military veterans and service members, close relationships. Let's see, she is a 3-time best-selling author. I will include her books in our show notes, of course, but she has wrote a book I'm reading right now called Beyond the Military. She co-authored here about life transitioning after military service. I'm also listening to your book Warrior on Audible right now about how we can support our those who protect us, our first responders and our war heroes. And then you were the senior advisor for suicide prevention for the Tragedy Assistance Program, TAPS, if I've said that correctly. Mm-hmm. Also worked for the VA, I believe, in the VA system for 8 years. And now you are the chief psychologist for Stella Center, which is what that's how I found you. That's what I'm really excited to talk to you about today. So thank you so much for joining us.
Of course. Good to be here, Tressa.
Thank you. And I know our video is a little fuzzy right now. I'm not sure if it's like that for everyone, but I've got the audio great, so I'll just keep going. Doc Springer, one of the things that I didn't understand when I was back in this military world, I was a special forces wife. I didn't have a real understanding of what post-traumatic stress was. And I've read a lot about it in the last 10 years. What I really want to do is define what is post-traumatic stress injuries. We've heard it, a lot of people have heard it as post-traumatic stress disorder. I'm just curious to define what's physiologically happening to a person who has a post-traumatic stress injury.
Sure. So post-traumatic stress disorder is the term that a lot of people used from 1980 onwards to describe a shift towards the perception that the world is unsafe and other people can't be trusted. In recent years, that has started to evolve into post-traumatic stress injury, given a new understanding of this physiological factor, which is that it is in part an injury. That it changes how our brains function. And people who have post-traumatic stress have a predictable set of symptoms where they're often in continual fight or flight. For many of my patients, they describe it as being like a muscle car that can't throttle down, where they're always kind of revving and unable to feel calm and in control in their own bodies. And so it definitely has a physiological component, but it is also a set of behaviors and how we navigate our relationships in the world around us that shifts. And so a lot of people will say, I feel like my personality really changed from before a traumatic exposure to after.
Yeah. Yeah. And what can that look like? What can that look like to someone on the outside? What can those behaviors look like?
A lot of times people around the person who is suffering will start to walk on eggshells because they will feel that something is shifted. They will feel the vague dread or anxiety that a person is experiencing and not really know how to handle it. And so post-traumatic stress definitely becomes something that impacts a marriage, a whole family. The partner will often change substantially to try and protect their partner. Will stop going to things that they used to go to. Try to make that
one
person,
of the words I describe a lot. I felt so isolated, but I wanted to protect him. So very familiar.
Right. Actually, sometimes, looking at a wife's response, a partner's response is a better indicator of how someone is doing than their own response. Sometimes I find that, warfighters they're so professionally good at compartmentalizing that they don't look that different on the surface. And what their partner knows is that at home, their partner is feeling continually tense and walking on eggshells and out of a sense of loyalty, trying to protect them by not saying anything. But sometimes partners are the better cue that something is really not right at home. Because when partners look different or they start withdrawing and that's not their normal behavior, that can sometimes be a better cue than how a warfighter looks on the surface.
Yeah, and you know what? I often say that he was so good at compartmentalizing because he would have really irrational moments. But if we did walk in and sit down with a therapist, he could be very mindful and calm. And I'd be looking over like, what's happening right now? You know?
Yeah,
But I think when you
yeah.
go into such high stress situations like war, you have to be very good and high pressure, keep your composure. So he was very good at compartmentalizing, which was hard for me to understand. And one of the things that struck a chord in me, you talked about walking on eggshells, and that really resonated with me. Um, we know a lot of times these soldiers are my ex-husband, my experience, he really was worried about getting help because he was very afraid of how it would affect his career. So he would have violent episodes and be very apologetic, and he would go talk to a chaplain. And there
Mhm.
were a few times he did go to a therapist, and he would always come back and he'd kind of be excited. He'd say, "We know what's wrong. It turns out I'm bipolar." And there was another time he said, I have irritable male syndrome. Or one time it was borderline personality disorder, and none of which I have any, understanding really, other than what you kind of Google and you find these things and you see mood swings and irritability and hypervigilance. And so I guess for me, I never really knew, was this trauma manifesting, or did he have, an underlying condition? And is that something that you hear in your work, or have you had other spouses say this, that they're not sure, is my husband a sociopath? Or, those were things that I would sometimes hear people say, and it's like they've literally, and of course my ex had trauma his entire childhood, and he was an
Mhm.
amazing soldier. So it was very hard to rectify that. You have this hero you respect so much, but the dichotomy was he was also doing some very abusive, things. So it was really hard to rectify.
Right. Yeah, it is a really complicated picture, Tressa. And it does depend on the individual. But a lot of times I've found that warriors are wondering themselves, am I a sociopath? Because of how they're behaving at home. And there's so much shame around that and a tendency to kind of lock it down and not want anybody to know. So he was going to a chaplain because a chaplain will not report up the chain of command, but it's a different thing, sometimes when you go to a mental health professional. And then when he did go in, he got a bunch of different diagnoses. Was it one of those? Without directly assessing him myself, I can't say, but what I can say is that trauma alone would be sufficient to lead to some of that behavior. And that oftentimes people feel they can't control themselves and it's really distressing to them. And so they lock it down and they don't want anybody to know. And they feel like they're a monster that, you know, can't control themselves with the
He would
people
use
they
that
love.
word as well. And I remember, no, you're not a monster. These are, I can't imagine how anybody would have that trauma and then be expected to acclimate into a normal daily life of like, okay, we're going to church, we're going to go to the grocery store.
Right.
So it's hard. And I really want people to be aware of what treatments are out there. So I'd like to talk, I found about the Stella Center. I was listening to, I don't know if it's Jocko podcast or Dakota Meyer, if you're familiar with him. He
Yeah.
was, Medal of Honor hero, amazing man. He was talking about getting the Stella ganglion block. So I want to hear about what you guys are doing at the Stella Center. And I think you have 50 locations now. So the only treatments I've ever heard of prior were talk therapy, and I heard psychedelics, and that was the extent of it. So I'd love to hear about what's out there now.
Sure. So, talk therapy is kind of the first line treatment for problems related to anger management, rage, and relationships. Sometimes it can work. And the first distinction I like to make with a patient is this predatory or reactive, this rage that they're exhibiting? There's a big difference. Predatory anger is premeditated. It feels like they are trying to control their partner because they feel like they own their partner and they give themselves permission to be angry. Reactive rage is more in reaction to feeling flooded by strong emotions, and they react before they have conscious control of the anger. One of the really big things that I've seen begin to shift in the field is this understanding of how much the biological elements of trauma change us biologically and how that is something we need to attend to. One of the things I've really seen shift, though, is a better appreciation of how much anger and aggression can be related to the biological impact of trauma exposure. So, specifically, that piece where a person really feels helpless and they don't feel they can control it, that they are reacting before they even have a chance to stop themselves and choose something different. And so, one of the reasons why Stella Center exists is to really address the biological aspect of trauma exposure. Specifically, when somebody feels hyper aroused in their body, and that's a predictable set of symptoms. We're talking about somebody who can't really sleep very well, maybe they're waking up multiple times at night, or they are overcome by sudden surges of irritability, they get heated, they become overwhelmed by panic attacks. Sometimes they can't concentrate, they can't read a book anymore because they keep reading the same line of a book. They feel hyper vigilant to their environment and every threat that could come at them. That is suggestive of a change in their fight or flight system. And people can stay locked into that state for months. It's commonly observed in warfighters that are deployed often and they're put in these fluid kinetic environments. It can change their fight or flight where they feel like they can't switch it off. And so that piece historically has never really fallen into psychologists' purview. It's, we have these techniques that can help them with these behaviors, but I think what we haven't appreciated is just how much of it is really out of people's volitional control. And that's where new treatments like stellate ganglion block, it's an injection of an anesthetic in 2 areas of the neck, can help restore calm and control to the nervous system and give people that momentary pause to think about, how do I want to respond to my wife? How do I want to respond in this scenario? Do I need to take that fight on? And so that's a really significant shift, really integrating the biological piece of things with the psychological.
That's super interesting. And I love that, because when I was in those situations, when he would calm down later, there'd be moments that he was very logical, but it was like he couldn't stop himself.
Yeah.
And he needed like a body reset, which is what it sounds like, kind of what you're saying this is, like a reset so that someone can be open to then doing the work, the emotional work. So that's very exciting. This is kind of a weird question, but is this something that has to be worked through the system through TRICARE, or could somebody who is thinking about this out of pocket come to Stella and do the Stella ganglion block? Is that something they could just take on themselves, or it really has to go through the TRICARE system?
So Stella exists to give people a pathway to confidential care, and anybody can avail themselves of that care at any time. It would be nice if it was covered by insurance, and I think we'll get there. But the truth is that insurance coverage always lags innovation. And so what we were finding is a lot of warriors, first responders, were very reluctant to get any kind of care. And they really resonate with this idea that there's an explanation for this that is partly biological. I mean, that's why, when you tell me that your husband would come home kind of excited about getting a diagnosis, it was because there was some rationale, some explanation that made sense of how he didn't feel in control of himself. And so, given this understanding of the biological piece, a lot of warfighters and others are like, yeah, that makes sense. I really don't feel like I can control myself. I do need this reset, this reboot of my brain so I can get back to a state of calm and control. But I love what you said, Tressa, because it's so important not to miss this. It isn't sufficient. So we could give somebody a reset, but in that window of opportunity, they also have to do some work. They also have to develop empathy for the impact of their unchecked rage on their partner so that it serves as a kind of a braking function. They also have to think of ways to navigate anger and conflict in relationships that work. What do you do when you're in a state of calm and control? And so Stella, we actually have decreased in size and increased in the amount of modalities. That's an important update. So we no longer are about how many centers can we put across the country, but we've really looked at our whole system of care and said, let's have fewer centers and let's do more modalities so that we have more to offer. And so we have these clinical centers of excellence in Chicago is our flagship, in Irvine, which is in LA. We're opening in San Diego soon. We'll be opening in Boston. We're in New York. We're in Washington. So we have these major centers, and we've started to bring in other modalities like ketamine infusions and transcranial magnetic stimulation, as well as our stellate ganglion block and therapy. Because if you don't do the work and really learn, how do I figure out how to have conflict? How do I have a good fight with my spouse? Then you get pretty quickly back to where you were, even with the reset.
Yeah, that's super interesting. Um, I think so. Something that's new to me is, after I left the situation, I was actually diagnosed with a secondhand post-traumatic
Mm-hmm.
stress disorder, which was news to me. I didn't know that someone else's post-traumatic stress could cause the spouse. And now my ex-partner, he has a second ex-wife, and she has severe post-traumatic stress. She's having panic attacks all the time and passing out. So would this be something that a person like ourselves who has suffered a secondhand could benefit from going to a Stella Center and possibly doing this treatment?
Absolutely. Secondary PTS is a real thing. People that are in a relationship with someone who's suffering are affected by a lot of the same symptoms. They become hypervigilant to, when the mood in the house will shift. Their life changes as well. They start to get very isolated from other people and other environments. They walk on eggshells. They're living in a lot of sometimes fear and doubt. And so secondary trauma is a real thing. What I see among military spouses a lot is this feeling of, but I didn't really endure any trauma. There's no specific thing that I didn't go to combat, I didn't go to war. So one of the big barriers there is overcoming that sense of I'm not deserving of treatment, care, and attention. And so I would say you absolutely can have these symptoms, and you're absolutely deserving of the best care and attention. Now, in a perfect world, well before a couple's relationship breaks down and they damage, there's damage to people in the relationship, we would actually prefer to treat couples together upstream. And we've done that. And those have been some of my favorite days in the clinic when we bring in a couple together and we treat them together. It can give both of them that reset, and then they can do the work to figure out, how do we have a good fight? How do we navigate conflict together? What are our new rules of engagement now that we have calm restored in our bodies? How do we move forward from here before they get to the place where the relationship, trust, and security is too far gone to really rebuild anything?
Ultimately, I really want the wives to feel a sense of community, but also to feel like there's, a beacon of hope, a light at the end of the tunnel. I felt so hopeless so many times. I felt so alone. And I wish, I was, 25 years old. I didn't know what I didn't know, and now that I've learned and read and all these things, I have a lot of hope, and I kind of feel rejuvenated about
Yeah.
helping people and spreading the word. So I'm just super excited to be talking to you. And I am curious, outside of you mentioned ketamine infusions. Can you tell me a little bit about that? And then I've read a little bit about eye movement? Could you talk about those two things?
Sure. So, I love what you said about it has to be supportive of the warrior as well as the spouse. There's no bad actor in a lot of these situations, even with horrible outcomes. It's their wives love their warfighters. And at the same time, both are deserving of treatment. And so sometimes there's a tendency to kind of say there's an identified patient in the relationship versus two people who are both suffering the predictable effects of trauma exposure on the part of one. And in an attachment relationship, both are affected because they're attached. There's a bond there. So I think really shifting the focus to let's take care of both people in the family or a family system feels really important. And there's a lot of reason for us to have hope now because we're really seeing a shift in the field of psychology to an incorporation of more of a biological and psychological model of care. I talked about stellate ganglion block as being helpful to potentially reset the system and bring calm and control back to the body. Ketamine is another treatment that I get to have a front row seat in seeing how that's rolling out. At Stella, we only do IV ketamine at this time. The reason we prefer IV ketamine is that the dose can be very carefully controlled. If somebody goes in the direction of unproductive suffering, then we can reverse it in the clinic. And we bring people into our clinics. We do it in a medically monitored setting with a very carefully controlled dose and oversight and supervision. And we want to do integration after the infusion. So it's not that somebody just comes in and they have this feeling of lightness and a relief of their anxiety for a time, but we really want to use the power of ketamine to reveal the things that they need to work on. So ketamine is one of the new medicines that is a psychedelic medication. And what that means is psychedelic, the word psychedelic means to reveal, delic is to reveal the psyche. And so they have this unique ability to reveal to us the things that are keeping us stuck, the core beliefs that we really need to focus on and grow through. And so ketamine is like having a waking dream where you have all of these specific insights and realizations that you wouldn't normally have that surface, and then they can be processed. We can capture those insights and we can figure out what to do with them. And that work is critical to get the benefit from ketamine. It just cannot be a passive, get the infusion, hopefully feel better. It has to be a combination with the psychological work.
That's interesting. So it sounds like in all treatments, there's no quick fix. There's no injection. There's no just pill you will take, but it's going to help strip away what's happening in your body, that fight or flight response maybe, so that you can be present for the work of the emotional side of it and doing those work of understanding how to control reactions and communicate and those types of things.
Yes. So when I've heard about Dakota Meyer talking about his experience in getting SGB, he talks about it being a flashbang that kind of gives you that moment of pause. And I think that's a nice way to put it because the treatments essentially give you a window of opportunity within which to take some action. And so the guidance and the insight that you gain in that window of opportunity will change the direction or the pattern of where you're headed. And so both really are essential. And what I'm seeing with my patients is they typically will see me for 6 sessions. We do 2 ketamine infusions a week over 3 weeks. This is not a long course of treatment. This is really different from a traditional, conventional, you're in therapy for 3 months or 6 months. I see them for 3 weeks and we really go deep very quickly. And they're able to change some fundamental things about how they see themselves or how they navigate their relationships with the world around them because they've been opened up with these new insights that are coming from their own psyche. And so you had asked me to talk about eye movement desensitization. So I want to talk about that for a minute because that is something I'm trained in doing. And it is very powerful for trauma. It's a little bit similar to ketamine in a sense. I think of ketamine as giving somebody a waking dream that's full of uniquely powerful insights for them and them alone to help them grow. And in a similar sense, EMDR manually kickstarts something close to what we do in our sleep state. When we are sleeping and we're in the state of rapid eye movement, we believe that the function of that is to help us kind of clean up our computer, to kind of process things and make sense of things and file them away in a place where we can understand them and put them in context, and they don't have the kind of power over us that a trauma can have. A trauma is kind of like when you have a sore tooth and any little thing that touches it just makes you react before you even know it. It causes these kinds of involuntary reactions. And so EMDR, the theory is that it manually kickstarts the rapid eye movement process, or the bilateral processing of the eyes going from right to left, can help regulate the nervous system, access memories that maybe we wouldn't have otherwise, and really help us to put things in context and file them into the greater meaning network that each of us has in our lives, so that a trauma event isn't so raw and doesn't have that power over us. And it can be very, very powerful for some of my patients.
So when a new person, that's super interesting. Thank you. I've read about it a few times, but I wasn't sure how it worked. So when a new patient would come to you, do you sit down and kind of assess which is going to be best for them? Ketamine, is there a patient profile for the different treatment types? Does that make sense?
Yes. 100% it makes sense. And that's actually what Stella is about. So, one of the big differentiators between Stella and other organizations that I see out there is that we have multiple modalities, and we will be continuing to expand our modalities. So, right now, we do stellate ganglion block, we do ketamine infusions. Sometimes we do a combined protocol, which we actually call the special operator protocol, that uses both ketamine and SGB in kind of a synergistic way. We have TMS, transcranial magnetic stimulation. I'm standing up a therapy service. To be clear, we're not doing EMDR in the context of Stella. I have a whole therapy service that really helps address the most common things that people present with, that I can really help them develop the insights they need in that window of opportunity after our biological treatments. But we're going to continue to expand those modalities. And it is so important to be what our CEO calls treatment agnostic. That means I'm not coming in saying everybody needs this treatment, but we have to look at each individual case and say, is this person really more struggling with the hyperarousal symptoms of trauma where they can't get calm in their own body? Or are they feeling more of the depression and the lack of motivation, the lack of energy, a change in their core identity? Maybe, could ketamine infusions really help address some of their symptoms a little bit better than SGB in some cases? And so we're really being thoughtful about which treatment for which person. And because we have multiple modalities, we can really look at each individual case and think about what is the best fit for each person, knowing that there's no one single right treatment for everybody.
Yeah, I love that. Really looking for the right patient type instead of just having assigned someone before you've dug in to really see what's going to work for them best. And now, my understanding is the stellate ganglion block. People, I think when I've mentioned it, it sounds like, oh, this is a brand new treatment. But can you talk a little bit about how long? I know it's been around since I think the 1920s, if I'm correct.
Yeah.
But talk a little bit about the history of it. Thank you.
Tressa, you've done your research. I salute you. I mean, you have really done your research prior to bringing me in for this interview. Yeah, I mean, a lot of people say stellate ganglion block, it's this new treatment, or it's this, innovative development. And in a sense, it is a newer treatment when applied to traumatic stress symptoms, but it's been around since 1920. 1925, 1926, there's documentation in the literature about how they used it for pain procedures. It's been used for pain complaints like shingles and complex regional pain syndrome, phantom limb pain when somebody loses a limb, for nearly a decade. And the earliest case of use for depression was in 1947, and it showed promise, but they really didn't pursue it. In 1990, there was a case of a girl who had been shot. She's a 15-year-old girl, and she had stellate ganglion block as part of her treatment. but not because they thought it would help with trauma symptoms. They just noted it as a kind of, that's interesting. She was better able to engage in therapy and, had a better outcome. But I don't think they really made the connection, because if they had, other researchers would have picked up on it and the research, would have developed from there. It didn't actually develop until 2008, when the chief medical officer for Stella, Dr. Eugene Lipoff, published a case of somebody that was an armed robbery victim, survivor, and he was not in a good place. This patient was headed to inpatient care because his PTSI symptoms were so severe. And Dr. Lipov said, I theoretically understand how this could help. And so it was really kind of a Hail Mary. Like, let's see if this helps this guy. And it took him from a place of very severe symptoms down to being able to just walk out of there without needing inpatient care. So that one case study that was published was the first case study that really looked at, can this really address trauma symptoms? And from there, the military and military clinician researchers have played a big role in really advancing this. There's also been researchers in the VA that have played a pioneering role in really exploring, can SGB work for trauma symptoms? And so there's been large case studies of 166 military, active duty military service members getting SGB with really good results. 250 soldiers at Triple Army Medical Center, 100% of them said they would recommend it to a friend. 100% of them said they would do it again. So people started to get really excited about it. And then there was this first randomized controlled trial, this first RCT. And that's what the scientific community looks for as far as, does this really work? Unfortunately, it had a very small number of people, 42 people. So it would be very hard to tell if something worked. And there were some issues about how the study was done and how it was run that created confusion in the results. So the results looked non-significant, but it just wasn't the study that we needed, essentially. And some of the people that have been part of that study have since said, yeah, this RCT, this new randomized controlled trial that came out in 2020, effectively replaces that first RCT because it had a much bigger sample size, over 100 people in this case. It was run across several military hospitals, and this RCT showed that SGB is a safe and promising treatment for traumatic stress symptoms. So since then, it's really, exploded in terms of the military system. It's offered in several military hospitals, in the National Intrepid Center, Fort Bragg, Walter Reed Medical Center, Womack, of course, Fort Bragg, Triple Army Medical Center, Landstuhl. It's offered there, and then it's offered increasingly in different VA hospitals. And it's the subject of a major research study, both at the VA and at NYU. So it's a matter of time before it hits a tipping point, but it isn't new. It's really been around for about 100 years.
Well, thank you so much for sharing that. I asked because I had been talking to someone recently who said, we're not lab rats. And I was like, no, this is not brand new.
Yeah.
This has been around for years. I know the first, I went back to talking about the studies in Walter Reed, and I even knew there was a trial that had like a placebo in it, and some things had, been challenging about that study. And so it sounds a little bit like Viagra, right? That came out for the heart, and then they saw these off-label uses that actually ended up benefiting people. So is it something that is being looked at for FDA approval at this time for the indication of treating post-traumatic stress?
I think we'll get there to FDA approval for that indication, but it requires those big, time-consuming, expensive studies. The VA is doing one of those studies right now, and there's a second one at NYU that's going to be using pre and post fMRI brain scans to show that trauma is a biological injury in part, and that that can be addressed very efficiently with stellate ganglion block. So that's the theory, and that's what is being proved. I think it's going to take those kinds of studies to get there. But I do think it's important to disentangle not FDA approved from the misconception that something is unsafe, untested, or fringy. So there's a lot of crossover in medicine between treatments that are used for pain and treatments that are used for psychological symptoms. I see it all the time. In my 8 years at the VA, I saw off-label use of medicine happen frequently. Based on the research, it can happen, in 30% of the time in certain inpatient units where a medication developed for one purpose is used for another. And one example would be the use of prazosin for nightmares. Prazosin is a medication that was not developed for nightmares, but it shows benefit for helping people if nightmares are really a strong symptom. And there's also, the use of aspirin for cardiac risk factors. That's a really important test case because aspirin is not FDA approved for cardiac risk factors. It was developed for pain and other, pain conditions, but it has shown this ability to reduce the risk of heart attacks. And so it's used all the time over the counter. And, everybody would agree that aspirins are very safe medication and, it's nothing anybody's worried about, but it's not FDA approved for cardiac risk factors. So FDA approved doesn't automatically mean untested and unsafe. And that's where people really need to look at the medical literature and notice that it's been used for 100 years. Some of the studies on its safety of SGB, one of them had over 40,000 participants in it. So it's not that people are being used as guinea pigs if they opt to undergo SGB.
I'm really glad you addressed that. And a background on me, I actually work in the pharmaceutical sales industry. And so the studies I nerd out over, I love that stuff. And I'm glad you explained safety and efficacy for the FDA because I think people who aren't in the medical world think not FDA approved, not safe. And so I'm happy you addressed that. One of the reasons I asked if it was going to be FDA approved is simply from a medical, a managed care landscape. I was thinking if down the road it was indicated, then it could be covered on TRICARE for Life or at the VA. And so I was thinking about it from that perspective. I hope it's one of those things that can be widespread. I was thinking the other day and just kind of nerding out thinking, what could this do for recidivism in jail for prisoners who have trauma and they can't do the work? What could this do if we could get this into the prison system? So I think possibilities are endless.
Right. And for those that, are corrections officers in the prison system as well. So it's kind of both sides. You've got a lot of times a situation where both parties are feeling under primal threat in their interactions with each other. What would it do if everybody on both sides of the equation had the option of getting calm in their body restored through this treatment and some therapeutic work to pair with it? I do think there's a lot of promise with this. There's a lot of promise with other medicines that are coming out. The psychedelics are very promising, and I think we have to be thoughtful and critical about our use of them and really not just get excited about them and then, it becomes this wild west of how they're used. I think we have to be thoughtful about it, but there is a lot of stuff that's coming down now that really could be a game changer. So yeah, I had a point and I forgot about it, Tressa. So I'm sure it'll come back if we keep.
No, that's all great. That's all great. No, that's super helpful. I think just the point is that this possibilities for this treatment and pending treatments, there's so many lives that can be changed because this is another thing I wanted to address, but I'm trying to be cognizant of time. But I read a NASA study that those who will end up with PTSI and those who won't, right? You send two people over and they're in the same type of atmosphere and they both experience these traumas. The overarching outcome was that people who had previous trauma in childcare, or I'm sorry, in their childhoods would most likely have an outcome. Is that something you could speak a little bit about? Like who might get PTSI and who might not?
It's a little more complicated than that though. So having childhood trauma, I've seen it go both ways, honestly. For some people who have childhood trauma, they develop a sense of the world isn't a very safe place anyway. And so it's not a big shock to them when they have later trauma. It can almost inoculate some people against that, because there are some that say PTSD or PTSI is when our assumptions about the world or other people are shattered. Your assumptions aren't shattered if you grow up with a sense of, I really don't know if the world is a safe place. And there are certain patients of mine that have had, like, they grew up on farms or in the country, and they've kind of gotten more comfortable with life and death, maybe had to slaughter animals, as part of their lifestyle. And so it's complicated. It's not always that somebody who has childhood trauma is going to develop PTS, but more often than not, that's the case. So I want to make clear that there are exceptions, but usually trauma is a cumulative burden, and unless it's addressed, it develops increasingly heavy weight over time. And so there is a truth about how trauma can be passed down from one generation to the next generation, and then can grow and grow unless it's addressed. And that's where I think these new treatments, you combine them with therapy, give people insights. A lot of people I meet with, they don't have a sense of what right looks like, or what it looks like to have conflict without unbridled rage. And so if you give them those insights, they can break that generational transmission of how things were done, of how people hurt each other when they fought with each other, of how people unleash their rage. They can change that pattern.
That's a great reminder. I don't want to generalize or stereotype and say that anybody who had trauma as a child is going to grow up and have, issues. So great reminder. But one of the things that triggered in my mind made me think of is, so for my previous situation, my partner was deploying 6 months, home 6 months, deployed 6 months, home
Yeah.
6 months. And so in that kind of cadence, it was almost like if he did start the process of getting help, then he was going over and experiencing new
Yeah.
trauma. So, I know we're about out of time here, but I just wanted to say, for things like that, getting upstream for people who are going to be continually in these situations, where should a person listening start right now? Where should they start if they're trying to get themselves or their spouse help to kind of minimize, some, I guess, their trauma?
Well, that is a really unique situation of the cadence of, special forces units being sent so often into combat, and they have these cycles like that. And I think that's a different scenario than somebody who had some traumas and now they want to heal from them, but the traumas aren't going to continue, or their environment has changed. Um, a lot of times in scenario two, where trauma has happened, but it's not likely to happen again, you can treat someone, do the therapy, and they kind of find a new normal. But realistically, with somebody who's going to continue to be exposed to traumatic events, you're going to think about maintenance and how you maintain a vehicle, for example. So, really, between combat deployments, you need to have a good doc, and you need to have, if you need it, a biological treatment that can help you um, get calm and control back, or address, whatever comes up. In certain special forces units, the stellate ganglion block is used this way between combat deployments. But it's really important that that is used in combination with doing some work. And a lot of times, warriors have a hard time finding somebody who really gets it, who is culturally competent and can hear their stories and not react with any shock, or um, anything but understanding, and just really walk with them through that trauma, whatever it is. And so a lot of times when it gets really bad, that's when people start looking for somebody when it's pretty far gone. And I would say the big lesson there is find a trusted doc before you need them. Because if you are in a bar brawl and you have your teeth knocked out and you're wondering at that point, is this really a good dentist? Can I trust this person? It's not a good time to be finding a good dentist. And in the same way, when you're really suffering and your trust is really it's just in shreds, and you need somebody who knows their stuff and is good at what they do, that person can become somebody who you check in with when you're home from deployments, and they become somebody who helps to heal you and maintain, things as you go. So those would be my two recommendations: is find a good doc before you need them, and then really explore what some of these biological treatment options are, because the combination of those two is what I have seen has the most power to both heal and help elite warriors maintain their operational capacity.
Amazing. Thank you. I think that's great advice. We don't want to, wait till the car is broken down before we decide to start changing the oil and maintaining it, right? So thank you so much. I'm going to have your books, your website, everything in my show notes. I wanted to ask you real quick, if any of our listeners want to contact Stella, how do they do that?
They would just go to www.stellacenter.com. Do you want me to say it again?
Amazing. I think you're going to change lives. I've been telling people that I think that you and Dr. Lipov might end up with some a Nobel Peace Prize. I think you're going to do some amazing things. You already have. So thank you so much for your time. It's been invaluable. I appreciate that.
Thank you. I appreciate you as well, Tressa, and your message of, there's not one person that's suffering when there's trauma, but also that military spouses are equally deserving of the best care that's out there.
Thank you for listening to today's episode. If you think this content would be helpful for someone you know, please share the link with them. Sources can be found in the show notes of today's episode.